when I sit down with a patient, one of the main questions after we diagnose what the condition is, and after we look at all the x-rays and consider the options, and I asked the question, I said, next question is, how much is this going to cost, doctor? And then what we have to do is look at which option do you think you can afford. We always want to know what is in your budget. We know what ideal is, but the question is, can you meet ideal? That's always the target. Or do we have A, B, C, or D that you have to use because you can't afford the A, the ideal? So I had a patient the other day, I said, do you want the Cadillac or you want the Volkswagen or you want something in between? Well, her husband came with her and he said, listen, I want my wife to have the Cadillac. Now, this patient actually was looking at the Nissan, like what I have. She wanted the snap on implants. And when her husband got there, this is 2 days ago, he said, listen, I think in the long range, it's going to be a better investment for me and her if we go ahead and get the permanent implants. And by the time we had that conversation, that's where they ended. Now, another lady earlier yesterday, she wanted implants. She was also with her husband, and he needed some work. But what he said is, listen, we can't do both of our work. Let's do her first. Then we talked about what's in your budget. She said, well, I can't have the implants now, so I'll do the denture and a bridge, and this is more in my budget. And then that's how we end our conversation. What do you want? What do you need? Now, what can you afford to do in this process?